Hello, welcome. I am Dr. Cassandra Cassidy, and with me,
Hello, I'm Nurse Karen Hernan.
yes. And so, what we want to talk with you today about is how to interview, or some things to think about interviewing. If you are in nursing school and soon to graduate, or if you are a recent RN graduate looking to obtain your first position. So, what I'd like to do is just start with covering some resume and pre-interview topics, and then I'd like to with you a little bit about the actual interview itself. And then I would like to talk with you a little bit about formatting your responses in that interview. And then I would like to talk with you and demonstrate with Miss Hernan how to respond to interview questions. So I'm looking forward to speaking with you about this content because it is a very important topic to prepare you for that initial professional job that you'll be obtaining as a registered nurse. So what you want to do is draft an inclusive resume referred to as a master resume. Okay. And what I mean by that is on this resume, you want to include everything that you've done up to this point in time that you're drafting your master resume. If you've won scholarships, if you've participated in student leadership positions, if you've held any kind of honor roll, anything like that needs to be included as key points. You want to include your work history, but not extensive details unless it is directly related to the position that you're applying for. You want to have headers for each position that include the position that you held in that employment status, who you're employed with, the employer's name, the city and the state, and the dates that you were employed. You want to make sure that you have consistent headers, consistent formatting for all your positions that you are referencing on your resume, as well as all of those headers. You don't necessarily have to include references. You can put a section header on your resume that indicates references available upon request, and then actually have those references readily available. The contact information for those references readily available should you be solicited to produce that. So for references on your resume or to provide, you will want ideally to have one from an instructor or a professor where you go to school, preferably nursing professor, relevant to the position that you're applying, so it's closer. Also, someone in the area of expertise in which you're applying would be ideal as well. So if you're wanting to have obtain a med-surg position, then you would want to have somebody who is already out working as a med-surg nurse, or as a to have as a peer reference, somebody that's already there and can speak to your acclimating into that environment well. So if you do know someone that's currently working in med-surg as a registered nurse, or if you do not, but maybe you had clinical that you experienced the med-surg environment with, and they can speak to your ability to acclimate to the demands within that area, then that would be somebody that you could ask to provide you a reference. It's nice to have at least two references as a minimum. If you don't know somebody that's already in the field, again, you can use someone that you went to clinical with, and then reciprocate with them to be a reference for them. Make sure it is somebody that you trust, though, in doing that, because when your references are contacted, they do get questioned regarding you, and you want to make sure that it's someone that will speak well on your behalf when solicited to do so. Also, it is ideal if you have a supervisor. Let's say, for instance, that you've worked previously as a nurse's aide, a certified nursing assistant, and you have a supervisor that you can list as a reference, a charge nurse or supervisor, manager, someone in that area where you demonstrated skills with patient care. That would be an excellent reference as well if you had that. And again, you could have this listed or not listed on your resume. If you choose not to list it on your resume, you still want the header and then just put available upon request. Okay, so your master resume, again, is one that's very inclusive. It has all of those professional attributes that you've accumulated up to that point, education, references, any certifications that you might have, including CPR. If you've already passed the NCLEX, then you want to include your license number when it expires. If you have not sat for the NCLEX yet, when you're eligible to sit for the NCLEX should be noted on that. And that will be insight information that your future employer will want to see. When are you eligible to sit for the NCLEX? You want your resume to be very short, concise. So you want to have it very concisely written and no redundancies. You want to make sure that you're proofreading it. You want to allow someone else to proofread it as well, just to gain feedback on the presentation of the layout, but also to help identify any grammatical errors or formatting errors that may be present. Again, make sure you're spell checking. Beyond that, you can then take that resume that you have saved as your master resume. And let's say, for instance, you found the job that you want to actually apply for. You take that resume. This is one recommendation and one resource. So I'm going to reference ChatGPT here. So if you have a job that you have decided that you are wanting to apply for, you can take this, the job posting that they have as a descriptor identified. You can copy and paste that into ChatGPT, upload your master resume into ChatGPT and give the instruction of tailoring the resume to speak to the attributes that is required within that job description. And you can request that there be a downloadable Word document generated, and then you can download that. You can look at that, make sure that it's formatted the way you want to, that it's inclusive enough and that hasn't omitted too many things that you feel is really important to be included. And then you can save that and actually use that resume to apply to the position itself. Again, you'll have your master for the next job that you're applying for, because you may end up needing to apply to 2 or 3 jobs. It could be the same job, but at different companies. And so you want to make sure that you keep that master, that you keep it up to date, that it's current. And even if you're already employed, you want a current resume, because what if someone said, send me your resume? And it might be a time sensitive request. And so you want to have something that's at the ready that you can go ahead and forward on to any potential opportunities. So now let's say you've applied, you have piqued the interest of the job that you've applied for. So you've been contacted. So you've got that first contact made, and now we're going to talk a little bit about etiquette. So they're reaching out to you to talk more with you, set up a time to talk more with you. You really want to make sure that in all probability, they may email you. And so if they are going to email you, you want to make sure that you are checking your email every 24 hours. You don't want to have a delayed response in getting back to a potential employer. If they contact you via phone, then if you are anticipating employers to call you, that means you have an unidentified or potentially identified, but you must answer your phones in a way that speaks to professionalism, because if it is a potential employer on the other end of the phone, just like the way you respond in the emails, you're automatically, from that very first contact, whether it's on paper through email or it's in live over the phone, you want to make sure that you're setting that first impression to be as valuable as to speak of you as possible. So you want to make sure that you are documenting with appropriate salutations, that you're always ending the email with something that says respectfully, appreciatively, best wishes, something that way that's formally closing out the email, and then your name at the bottom. So addressing them a formal name. Don't presume that it's okay to use their first name only. Use their actual appointed title and their surname, and then you use your full name as well. And then the content itself, somewhere in that content, it needs to speak to the appreciation of being considered as a candidate, right? You are grateful that they're taking the time to reach out to you. And so you want to make sure that you reflect that in some of your closing remarks. And so you just really want to reinforce that you are very enthusiastic about the potential position and you're grateful that they are considering you as a candidate and wanting to move forward with that consideration. So however that sounds well to you, and we all express ourselves differently or uniquely, but we want to make sure that we're maintaining that degree of professionalism. And so if you're really uncertain about, is this reflecting professionalism and appreciation for this interaction or this consideration that's being given to me, you could copy your draft email, drop that in ChatGPT or something else that you're more familiar with or can appreciate, and just request a proof this to ensure professionalism and a show of appreciation. And then see if there's any recommended modifications. Either that, or you could have someone else proofread it before you send it, just to have that confirmation that, yes, this is actually saying what I want it to say. This is important because, again, you're setting that impression right out of the gate. Okay. Remember, you're being judged from the first interaction. You're setting the tone of the impression, and you want to paint it how you want it to look. Okay. How do you want it to look? So that's just getting us up to the interview. So at the interview, you want to make sure that you're dressing one step up from what you're going to be required to wear where you are going to be employed. So let's say, for instance, you're going to be required to dress in scrubs when you go to your job that you're interviewing for. So therefore, you want to go business casual. Okay. And when we think about business casual, that really can mean different things to different people. What we really mean is here I'm recommending is that we are moderately conservative. So we're not overexposing any flesh tones. We're not having any loud scents on us or smells. And so I'm appearing very clean and well groomed. Okay. Wearing seasonally appropriate clothing. Okay, it is also good to get to wherever you're going 15 minutes early. And that doesn't mean getting and sitting in the car until 15 minutes and walking in. It means that you're actually ready to knock on the door 15 minutes early, because what if the elevator's down and you have to take the stairs? Or what if you got confused and you were at the other end of the building and you had to get somewhere else? You want to make sure you are exactly where you need to be 15 minutes early. And it's okay to go ahead and check in. Let's say there's a receptionist, or you're told to greet the clerk and let the clerk notify the interviewing body that you're there. It's okay to do that 15 minutes early. That clerk will acknowledge or recognize, and you can even tell them I'm 15 minutes early. So I'm happy to wait. I just wanted to let you know that I'm here to meet with so-and-so at whatever time, and the full name, and at whatever time you're there to meet. Whether this gets reflected on to the interviewer to note that you're early, it very well may, but even if it doesn't, that gives you time to ensure that you're not rushed, you have time to clear your head, and that you are not late. It's very important to be on time. Settle your mind. So you've modified your resume that you used to apply for the position. If the resume doesn't highlight the components that you want to express that sets you apart, speak to those at the end of the interview. Okay, and it's very well likely that during the interview there'll be opportunities for you to work these things into the interview to augment some question or discussion that's ongoing. But if not, then at the end that you can share these things, particularly if you're asked what sets you apart as a candidate. And it's certainly appropriate to speak of these things, speak highly of yourself. Sometimes it's awkward for us to acknowledge or to share those positive things about ourselves. We might feel like we're bragging, but this is the time that you are selling yourself as a candidate, and you do want to set yourself apart and highlight the value of the things that you have already done, that will speak to what you can bring to that organization in the position that you're interviewing for. And so you certainly want to make sure that you want to point those things out. And they may pull those things out themselves during the interview, but if they don't, then it is okay to highlight yourself by pointing those things out, because again, you are being weighed. Okay, so some of the interview question formatting, let's talk a little bit about that. You want to be prepared for basic questions, okay? So some of the basic questions you can anticipate, certainly you can Google, you can go into different AI and generate different types of questions, and you should for any specific position, and you should just to see what they generate for you to review and have some basic questions in mind for that. You want to prepare yourself most appropriate for whatever that specific job is. So focus questions and preparations. You want to start by going on their website. You want to look at their mission statement. Because what if they had a question to you that says something regarding their mission statement, like what part of our mission statement speaks to you as a candidate? And so you would need to know what their mission statement involved. You would have to know verbatim per word, but you would have to know the theme of it to be able to speak to it. And it shows that you're invested in that institution and that you reviewed and researched and feel like you align with their mission. And also look at what their values are. And so you want to make sure that you on their web page also you want to look at their values. And so the same thing regarding a question about values. How do your values align with the values that we have here? Or do you feel your values align? So you really must prepare in case you get one of those questions, because what they want to know is who are you as a person, and are you going to fit into our culture? So you want to look at their organization. You want to also see who the leadership is in the area that you've applied to as well. And in the hierarchy, really who is who at that institution. So you want to make sure that the job description that you applied for, you want to make sure to speak to the components within it that they have prioritized as being essential to being successful in that role. So this means think through possible questions referencing each component that they've itemized out again in that job description. Use different resources to help generate questions, or you should be able to think through largely yourself, but then start testing yourself with other type of generated questions. So let's say, for instance, one of their job descriptions components included providing patient-centered care. Then you'll want to speak to a way that you've demonstrated patient-centered care, an experience that you have had regarding patient-centered care. And so what if you have never worked with patients outside of clinicals? You're a new grad. You may not have CNA experience or certified nursing aide or unlicensed assistant personnel experience. And so you really want to highlight what experiences you have had in the clinicals. So you have had experiences. And so you want to think through the experiences that you have had and correlate that with what they're asking you. So using your clinical experiences, pull from how you've adapted the standard approach to patient care based off of something that was unique about a patient, and you tailored it accordingly. Whatever you did, the care provided was tailored providing that patient care. So you could think along those lines based off of the job description, being professional, patient-centered, patient assessment, being a good communicator, collaborator, and a good basic question in any job interview is tell me about a time when you collaborated to improve a patient outcome. What they want to know is that are you going to be able to communicate, solicit help when you need it, and ultimately have good patient outcomes? So you're a new grad. We don't expect you to have the enhanced knowledge, but you will need to demonstrate you have registered nurse assessment skills. You can communicate when you need to, collaborating, getting the additional resources, shared knowledge, learning what you don't know, and ensuring that your patients stay safe and they have improved outcomes because you caught something or you improved something or because of what you assessed or you communicated and what you modified in your scope. Okay. So again, you may not have that actual outcome, but that to be able to speak to patient outcomes from your clinicals, through your clinicals, depending upon the question, but there may be something that you can pull up to speak to that correlates. So you really want to think about team dynamics. Maybe you had a group project in school that you went through. You may have had previous healthcare experience, or perhaps maybe, again, limited clinical opportunities to reflect upon. So think about other things that have gotten to where you are. You are more than just what experiences you embody as a nurse. You're bringing your world experiences with you. And so maybe you have, if you don't have the experiences, you never want to say, I don't have the experience, because you do have life experiences. And so capitalize upon what life experiences you do have. And then that is what you want to speak to and align it. So maybe you've been a cashier somewhere. And maybe you've had a disgruntled client come through. How did you resolve that? And maybe this is directly part of a question. You can correlate it with that. Reflect on whatever that critical thinking process was in that situation, the critical thinking process was, and how did you assess that, right? How did you prioritize what you did? How did you collaborate to help resolve the issue? What you actually did in actions, and then what was the outcome? How was it resolved? Ideally with positive or preventive outcomes. When you're sharing a story, you want to make sure that you reflect well at the end of it. Again, how did you diffuse a situation? What was the outcome? And so you could pull on that if you need to, because what you don't want to do is say something like, I don't have experience, right? Instead, you want to say something like, during clinical rotations or during simulation experiences or teamwork in school or leadership roles that I've held. So those count as experiences. And so you want to pull from those. Okay. Always speak to something that is relevant to their question, though, when you're doing it, and it shows that you recognize that you collaborated and you resolved. Okay. Okay. Here's another little tidbit. In that process, you want to make sure that you avoid speaking negatively about any previous employers in the interview. This is an important thing, that you avoid speaking negatively about a previous employer. Okay, so what I'd like to do is just transition a little bit about and talk about STAR response formatting. The STAR method is a simple way to help structure your responses to any type of question. Mostly these questions, this is to a behavioral interview questions, which is becoming much more popular, and really helps to guide the interviewer to assess your behavioral patterns and how you think. And it's very common in nursing interviews, especially for new graduate RNs. It helps to tell a clear story that shows your clinical judgment, teamwork, and communication skills, and that's why these type of behavioral questions are popular. So STAR stands for S is situation. So you want to describe in response to a question, a situation, the context or background of the situation. Where were you? Was it a clinical rotation, sim, on the job? Where were you exactly and what was happening? So you want to describe the environment and what was happening within it. An example, during my med-surg clinical rotation, I was assigned to a patient who became increasingly short of breath. Okay, that's the S. The T stands for task. Okay. You want to explain your responsibility in that situation. What was your role? What was needed to be accomplished? So an example is my responsibility was to assess the patient and report any changes to the RN I was working with. The A stands for action. You want to just describe specific actions that you took. And so here, the most important, which is actually the most important part of your answer. So it really needs to focus on your assessment, assessments in general, communication, critical thinking, and teamwork. So an example could be, I checked the patient's oxygen saturation, which had dropped to 88%. I repositioned the patient, reassessed lung sounds, and immediately notified the nurse. I also gathered oxygen supplies so we could intervene quickly. So that's a well-rounded response there. Okay. And then R is result. So explain the outcome and what you learned. So interviewers love to hear about patient safety, teamwork, and learning. So they want to know that you're going to be able to acclimate to the demands and the requirements within the environment that they're considering putting you within. So here's an example for that. The nurse initiated oxygen therapy and notified the provider. The patient's oxygen saturation improved, and the experience reinforced the importance of recognizing early signs of respiratory distress and communicating quickly. So that's an R. So that's a STAR, STAR response. Okay. And so that helps you to think through each of the components that's needed to help prevent you from giving an incomplete answer or response. They want to see the thoroughness and the scope of the response or the actions that was ongoing and how you work within it. So STAR helps you to help you provide that well-rounded response. So this is, again, really good with behavioral health. It's really behavioral type questions. It's really good with questions like, tell me about a time you dealt with a difficult patient. Describe a conflict with a coworker, or tell me about a time you made a mistake. Another time you might see this type of need to respond this way would be, describe a time you advocated for a patient, or tell me about a stressful clinical situation. So that would be some of the things that you could be exposed to. These are all prime contents. Also, those are the kinds of stories. So you need to prepare yourself for some ready stories. Think through some stories that you can give the kind of responses that you want to provide and show a well-rounded answer that reflects well on you at the end, right? And so think through teamwork stories, think through difficult patient stories, think through patient safety stories, conflict stories, leadership stories. So you can have, and you can use one story for more than one response, because there's different aspects to the story. And so you can, if you need to, you can use the same story for and again, from that same example I previously showed or discussed with you, it applies here as well, because then differentiate how it's applicable to that next answer to give them what they're looking for, still using the STAR format. So what I'd like to do, Ms. Hernan, is have you demonstrate some responses to some standard common nursing interview questions. So are you ready?
I'm ready.
Okay, great. So tell me about yourself. And what I'm really looking for here is a professional summary and passion for nursing. So Ms. Hernan, tell me a little bit about yourself.
I recently graduated with my BSN and completed clinical rotations in med-surg, ICU, pediatrics, and community health. And during my med-surg rotation, I really developed strong interest in caring for complex adult patients and working in a fast-paced environment. My instructors often complimented my communication with patients and my attention to safety. I'm excited to begin my career in a setting where I can continue learning, develop strong clinical judgment, and provide compassionate, patient-centered care.
Okay, thank you. Right. Also, why did you choose nursing?
I chose nursing because it combines science, critical thinking, and compassion. I've always been drawn to helping people during vulnerable moments. What really solidified my decision was seeing how nurses advocate for patients and coordinate care with the entire healthcare team. I want to be someone who not only provides safe clinical care, but also supports patient and family relationships.
Okay. Could Thank you for that. Why do you want to work here?
I was drawn to this hospital because of its strong reputation for patient-centered care and its commitment to supporting new graduate nurses through residency programs and mentorship. As a new nurse, having a structured environment where I can continue learning while providing safe care is very important to me. I also appreciate the hospital's focus on teamwork and professional development.
Tell me about a difficult patient situation.
Sure. During my clinical rotation, I cared for a patient who was frustrated about being hospitalized and frequently refused care. I took time to listen to his concerns and acknowledged that being in the hospital can feel overwhelming. After building rapport, I explained while certain treatments were important and gave him opportunities to ask questions. By the end of the shift, he became more cooperative and thanked me for taking the time to talk with him.
Great. Tell me, how do you handle stress?
I handle stress by staying organized and focusing on prioritization. In clinicals, I learned to start my shift by reviewing patient needs and identifying time sensitive tasks. When things become busy, I focus on what is most critical for patient safety and communicate with the team if I need assistance. I also try to stay calm and take a moment to refocus when I need to so I can provide safe care.
And as a hospital looking to hire, this next question is what we're really wanting to see is honesty. We're wanting to see patient safety awareness, and we're wanting to see learning mindset. So with me trying to obtain that information, I'm going to ask a question like this. Describe a time you made a mistake.
During clinical, I once almost documented an intake incorrectly because I misread the measurement. Before submitting it, I double checked the chart and realized the error. I corrected the documentation and spoke with my instructor. That experience reinforced the importance of slowing down and verifying information, especially when documenting patient care.
Thank you. How do you prioritize patient care?
I prioritize using patient acuity and safety frameworks like ABCs, airway, breathing, circulation. I also consider time-sensitive medications, changes in condition, and provider orders. I organize my tasks at the beginning of the shift, but remain flexible because patient needs can change quickly. Communication with the healthcare team is also important when priorities shift.
Tell me about a time you worked on a team.
During my clinical rotation, our patient experienced a sudden drop in oxygen saturation. I immediately notified the nurse while another student gathered oxygen supplies. The nurse assessed the patient and contacted the respiratory therapist while we assisted with positioning and monitoring vital signs. The experience showed me how effective teamwork and communication are essential for responding quickly to patient changes.
How would you handle a conflict with a coworker?
If a conflict occurs, I would address it respectfully and privately. I would focus on understanding the other person's perspective and keeping the conversation centered on patient care. If the issue involved patient safety and couldn't be resolved directly, I would follow the appropriate chain of command to ensure the patient receives safe care.
Why should we hire you?
You should hire me because I'm a motivated new graduate who is eager to learn and committed to providing safe, compassionate care. I work well in team environments and take feedback seriously so I can continue improving my clinical skills. I'm excited to grow in a hospital setting where I can contribute to patient care while developing into a strong and reliable nurse.
Thank you, Ms. Hernan. As an interviewer, we want to see interest. We want to see inquisitiveness about the position, the culture, expectations of the role. So nurse managers love when candidates ask questions, thoughtful questions. Here's some. What does success look like for a new nurse in the first 6 months? How does the unit support new graduate nurses as they transition to practice? What qualities make someone successful on this team? Or you could ask questions like this. What qualities make someone, how do you support professional growth to your nurses? Ask about schedule commitments, work-life balance, insights that you can gain related to that. And also remember, you're interviewing them as much as they're interviewing you. And when you are a new graduate, you need to do your homework more than ever to see where you want to plant your initial growth professionally as well as financially. Make sure your first job aligns with your 5-year plan. And if you don't have a 5-year plan, create one. Your first job onboarding is when you will receive your best orientation. And ideally, it's in an area that you see yourself staying in or is strategically to transition you to the next step in your 5-year plan. I hope that this has been helpful to you and that certainly or to benefit you in considering your preparations for your registered nurse position. Thank you, Ms. Hernan, for joining us
My
today.
pleasure.
Okay. Bye-bye.